Okay, so our next topic in line is the neuromuscular blocking agents that we are going to look at. We shall be interested in looking at the clinical use of these neuromuscular blocking agents. The mechanism of action, the neuromuscular blockers displace acetylcholine from the skeletal muscles, nicotinic receptors. The nicotinic receptors are the ones found in the skeletal muscles. We have the non-deflorizing blockers. They bind to the acetylcholine receptors, preventing muscle contraction. Okay, non-deflorization action prevents the muscle contraction. And then the deflorizing blockers initially cause muscle contraction. So once there is depolarization, there is an initiation of action potential, then the muscle starts to contract. The non-depolarization is the opposite of it. Okay, but this once depolarization occurs and then repolarization follows, and then that one leads to the paralysis of the muscle. So it's like an on and off action based on the agonist and the antagonistic actions of the neurotransmitters. Pharmacologic effects, they cause muscle relaxation, inducing paralysis for various medical purposes. They have no effect on consciousness or pain perception. They cannot cross the blood-brain barrier, and thereby ensuring patients are not awake and experiencing pain during the procedure. So actually, they don't cross the blood-brain barrier like the other drugs we looked at previously in other lectures. The therapeutic uses, they are also used during endotracheal intubation, okay, when we are inserting an endotracheal tube. It facilitates the mechanical ventilation in the critical patients. They are also used in the ECT, the electroconvulsive therapy, and enhance muscle relaxation during the procedure. Let's look at the adverse effects of these neuromuscular blockers. The non-deflorizing blockers, we have the example here is panchronium. Uh, the adverse effect, we mentioned earlier on that they cause muscle relaxation. But one of the adverse effects could be respiratory arrest because again, it will cause a relaxation of the respiratory muscle and breathing might be compromised. Okay. Also, it causes hypotension, may result in low blood pressure in some cases. Now, if we look at the depolarizing agents, the example here is what we call acetylcholine. This might cause prolonged apnea. Apnea is inability to breathe. Okay, certain individuals are genetically unable to metabolize acetylcholine and may experience extended paralysis causing the prolonged apnea. Also, we have this what we call malignant hyperthermia. That is uh, rare but severe reaction characterized by high body temperature. It causes increase in body temperature and also muscle rigidity. Still continuing with the adverse effects, interaction with inhalation anesthetics, potential effects of inhalation anesthetics like influence. So, like if somebody is given inhalation anesthetic, this drug might interact and causes reverse effect because it potentiates, so it increases the effects like an agonist along the same line. Treatment intravenous dantrolene, which is a skeletal muscle relaxant, is used to manage malignant hyperthermia that we talked about. Differentiating from neuroleptic malignant syndrome, this is associated with antipsychotic drugs but presents quite differently. Uh, Also, we have postoperative muscle pain as one of the adverse effects. Some patients may experience muscle pain after undergoing procedures involving neuromuscular blockers. Hyperkalemia, this increased levels of potassium. This can be a serious complication. Neuromuscular blockers can lead to increased blood potassium, and this can cause heart problems as well. Potential consequences: severe hyperkalemia may lead to cardiac arrest and even sudden death. Patient safety, and in conclusion, we said adequate monitoring is needed. Close monitoring of patients receiving neuromuscular blockers is crucial to detect adverse effects promptly. We can also use individualized dosage therapy so that we tailor the dosage according to the needs of that particular person or according to the condition of that particular person if he has another medical condition or etc. So in conclusion, we said neuromuscular blockers play a critical role in the medical procedures requiring muscle relaxation and paralysis. So mostly in all our theater procedures, these drugs all fall in this category because they cause muscle relaxation. So before we can do any procedure, the person is sedated and muscles are relaxed. Despite their benefits, careful consideration of adverse effects is essential to ensure patient safety and well-being. So one person with these drugs is the point of the cardiac arrest that we talked about. You might have heard about people dying in the theater just because of anesthetic overdose. Okay, so this is one of the causes that is always have to take into consideration. Okay, we leave it there for now. Thank you so much and see you in the next slides.